KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. The use of BMI, body mass index, as an indicator of health has been ubiquitous in health care for decades. However, it's not necessarily an appropriate indicator of health, as we're learning today. Recently, the American Medical Association has adopted a new policy clarifying the role of BMI as a measure in medicine. Speaking with us about this issue today is Dr. Thiara. She's a primary care physician and medical director at the UCSF Weight Management Program. Thank you so much for joining us today, Dr. Thiara.
Thanks for having me.
So what has been said about this new clarification about BMI as far as a person's health is concerned?
The AMA has put out this position statement saying that the BMI may be useful based on population level data, but when we look at individuals one-on-one, it may not be the best metric to predict cardiometabolic disease. And the reason why is that it's quite limited when it comes to race and sex. So the AMA is positing that we as primary care doctors and physicians at large use more nuanced tools to better assess a patient's cardiometabolic risks rather than just the BMI alone.
So what does that mean for patients? Should we really be paying attention to the BMI, or does it have any value as an individual who gets on a scale?
That's a very interesting and nuanced question. The BMI is a good tool, again, at population level. So when we look at screening tools, we want them to be sensitive. And so what that means is we'd rather overdiagnose and not miss somebody rather than underdiagnose and miss patients who then won't really get the right screening and right lab tests and so on and so forth. So for patients, the BMI is something that will probably be a part of your chart and your health care. But what's important to note is that there may be things about you as an individual where that BMI number does not really accurately predict whether or not you're at risk for something like a heart attack or stroke or diabetes or other mechanical diseases associated with obesity like arthritis, sleep apnea.
What are some of the other issues we're seeing with BMI in terms of measuring health, but maybe not being so accurate with different ethnicities, genders, etc.?
Yeah, so when we think about BMI and its limitations, it's really important to look at the history of how BMI was developed. This will elucidate all our present day limitations when it comes to patient care. So the BMI was developed in the 1700s by a Belgian scientist who was trying to understand what the ideal weight was for European white men to be quote unquote healthy. Our modern day use of BMI was developed in 1972 by someone named Ansel Keys. And Ansel Keys looked at population level data to better understand what weight to height ratios would predict cardiometabolic health. But again, when we think about what research was being done in the 70s, it was done on white men. And so there are huge groups that are left out from this. One is racial differences. So we know that in certain racial groups, specifically our Asian and Asian American patients, they have higher rates of adiposity compared to muscle. And so what this means is that BMI may not really be accurately predicting cardiometabolic risk because it's under predicting that risk for these patients who have higher rates of fat to muscle. A lot of work has actually been done in this space. And so our Asian and Asian American patients actually have lower BMI cutoffs when it comes to these risk factors. A lot of providers are not even aware of these differences, actually. And so most patients aren't either. Their EMRs or their charts that they're seeing are not accurately showing what these different BMI cutoffs are for them. But it's really important to have that dialogue so that providers start to look into this more and that patients, sometimes take on that health information for themselves to ask their providers about that. The other side of the spectrum when it comes to racial limitations with BMI is in our Black and African American patients. We know that in this population, they have higher rates of muscle compared to fat than in white men. And so BMI may overpredict cardiometabolic disease. but it's not as simple and it's not as clearly elucidated as it has been in our Asian and Asian American patients because there hasn't been as much research. So there have been studies that have looked at diabetes risk correlating to BMI in Black American patients, and that correlation is quite strong. But we haven't looked at other diseases like heart disease, cancer risks, mechanical disease associated with obesity. So there's still a paucity of research for this patient population. When it comes to the Latinx community, again, paucity of research. We know that in Latinos, sometimes there's more adiposity centrally compared to on your limbs, and that can increase risk for heart attack and stroke. But again, the research is lacking. And then
everybody's different.
Yeah, everybody's different. And then the other huge limitation is sex. So women were not included in those studies. And we know that women have higher rates of adiposity than men. But a nuanced factor here is that premenopausal women have hormones that protect them from cardiometabolic disease that postmenopausally women lose. So a lot of research is lacking here, and we need more work to look at both premenopausal and postmenopausal women as separate groups to understand how excess weight may be impacting overall health in the long term.
What is some of your intention and hope as someone who's a diplomat in this field, as far as like training physicians and other clinicians in order to help folks understand whether or not BMI is a good indicator for their health?
My hope would be that at all levels of education, we focus on obesity as a chronic disease a lot more. So the majority of medical schools barely touch upon obesity as a disease, and most don't have any nutrition education provided to their students. I was very lucky where I went to medical school and now working at UCSF, where the schools of medicine do devote time to obesity education. And we teach the students at UCSF about BMI and its limitations, and we'll definitely incorporate this new AMA guideline in that. But this needs to be writ large across the entire country. And something like the USMLE that board certifies students needs to incorporate this into the testing, because that's usually how we see change. When a student has to be tested on it at a national level, the schools will fall in line to add it to their curriculum. So I think that's one part. And then the second part would be for trainees at the GME level. So residents should also be engaged in caring for patients with obesity. Regardless of your specialty, you're going to interact with a patient with obesity. You need to have obesity bias training. You need to understand these limitations around BMI so that you care for your patient as an individual and don't stigmatize them so they don't feel comfortable returning to you. So the last place that we would need to really see changes is in practicing physicians. It can be challenging to update the way people practice medicine and the way they have practiced medicine for decades. But we're all very plastic, and we evolve to incorporate new medications into our practice and new guidelines around antibiotics and so on and so forth. We should be doing the same thing with obesity medicine, and we need to have providers really engage in learning more about this topic, even if it's challenging, sometimes conceptually challenging to understand.
Thank you so much for joining us today, Dr. Thiara.
Yeah, thank you for having me. It was a pleasure talking.
Dr. Diana Thiara is a primary care physician. She's also medical director at the UCSF Weight Management Program. You've been tuning in to As Prescribed. I'm Alice Wertz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.